First, performing a quick scan of the room. Note card, equipment. Okay. Great. Hi, Shelby. My name is Jacob Pushy. I'm going to be the nurse practitioner soon taking care of you. Can you just confirm your name and date of birth for me?
Yeah, Shelby Pushy, 22898.
I'm just going to first start with your hair. And your head. Head is normocephalic. Hair is evenly distributed. There's no visible scaling or rashes on the scalp. Do you mind if I touch your head?
Nope.
Touching the head. Again, hair evenly distributed. No rashes or scaling. No lumps or bumps palpable. Hair is of coarse texture. Great. So next I'm going to move on to your skin. Observing your skin, there's no open areas. Skin is a even normal tone. No open areas, no lesions or rashes. Do you mind if I touch your skin?
Nope. Touching
your skin. Skin is warm and moist to touch. Next I'm just going to take a look at your nail beds. Your nails. Nail beds are pink. Nails are firm and shiny. Cap refill is less than 2 seconds. And I'm just going to assess your skin turgor here. Great. Skin turgor is less than 1.5 seconds. Wonderful. So then I'm going to move on to your eyes now. Looking at your eyes, conjunctiva are clear. There's no ptosis of the lids, no tearing, and your eyebrows are evenly distributed. So I'm just going to touch your eyelids now, if that's okay.
Yeah.
And then I'm going to have you lift your eyelids up. Great. So cranial nerve 3 is intact. So now I'm going to assess your extraocular movement. So I'm going to have you just look at my nose, and I'm going to have you follow my finger using only your eyes, and keep your head still. Great. So cranial nerves 3, 4, and 6 are intact, and your eyes converge to your nose and accommodate equally. So next we're going to move on to assess your corneal light reflex. So I'm going to have you continue to stare at my nose. I'm just going to shine this light. Great. So the corneal light reflex is present and equal in both pupils. So next we're going to assess for direct and consensual light. So continuing to stare at my nose, I'm just going to place my hand here. Okay, great. So both pupils respond equally to direct and consensual light. Next, we're going to assess your peripheral vision. So I'm going to have you cover your left eye for me and continuing to stare and keep your head still at my nose. I'm going to put up some numbers, and I'd like you to tell me what they are.
2, 1, 1, 2.
Okay, great. And then we're going to switch to the next eye.
1, 2, 1, 2.
Great. So next I'm just going to grab my ophthalmoscope. Okay, great. So I'm just going to stare at the wall. I'm going to come in at a 15-degree angle. Place my right thumb here. Left eye to left eye. Alright, so the red reflex is present. Optic disc is orange to pink in color. Vessels are visible. Borders are clearly defined, and there's no AV making. So we're going to do the same thing on this side now. I'll have you continue to stare at that wall. Coming in at a 15-degree angle. Right eye to right eye. Red reflex is present. Optic disc is orange to pink in color. Vessels are visible. Borders are clearly defined. And there's no AV making. Great, thank you.
Yeah.
Okay. Okay, so next we're gonna move on to your to your ears. So I'm just gonna take a look at your ears, your pinna of your ears. There's no erythema or swelling, no abnormal nevi, no visible drainage out from the pinna. There's no scaling or rashes or open areas of the skin. So I'm just going to palpate your ears now. Is there any tenderness when I do that?
No.
Great, so no tenderness. Bilaterally to palpation. So next we're just going to do a little test called the Weber test. So I'm going to place this tuning fork at the center of your forehead, and I want you to tell me if you feel it bilaterally or one side or the other more so, okay?
Okay. Bilaterally.
Equally?
Yeah.
Great. Okay, so that is a normal finding for the Weber. Next, I'm going to do a Rene test. So we're going to go one by one at each ear. I'm going to place this behind your ear, and I want you to tell me when you stop feeling it, and then we'll go like this, and I want you to tell me when you stop feeling it when it's in that direction as well.
Okay. Now. I can't hear it anymore.
Okay, great. So we're just going to do the same thing on the other side.
No. And I don't hear anything now.
Great. So that's a 2-1 ratio. That's a positive Rene. That's a normal finding. So that's great. Next, we're going to move on to the otoscope. So I'm going to place this scope on. We're going to take a look inside your ears, okay?
Okay.
Okay. So pulling the tragus up and back, going in at 12 o'clock. We see no erythema, no scaling or swelling. The tympanic membrane is pearly gray in color, and the cone of light is at 7 o'clock. So doing the same thing over here. So there is no erythema, no swelling, no drainage. The tympanic membrane is pearly gray in color, and the cone of light is at 5 o'clock. That's great. More normal findings. So next we're gonna take a look at your nose. So looking at your nose, it's the same color as the rest of your skin, and it is symmetrical in place. Do you mind if I touch your nose?
Nope.
Is there any tenderness with that?
No.
Great. While I'm here, I'm just gonna be palpating your sinuses. So I'm gonna go with your frontal sinus, and you tell me if there's any tenderness when I do this.
Okay.
Frontal sinus, ethmoid sinus, and maxillary sinus. Any tenderness with that?
No.
Okay, great. Next, I'm just gonna have you sniff up with your nose. So plug one of your nostrils for me, and sniff up, and then plug the other nostril, and sniff up. Great, so nares are patent. Next, we're just gonna take a look in your inferior and middle turbinates. So I'm just gonna take your nostril here. Your inferior and middle turbinates are visible. Mucosa is pink, and there's mild drainage. In the other, again, inferior and middle turbinates are visible. Mucosa is pink, and there is no drainage. Great. Next, we'll move on to your mouth. So I'm just gonna have you open your mouth for me. I'm just gonna take a look in. So gingiva are pink. Buccal mucosa are pink as well, and there's no swelling or discoloration. Stetson ducts are visible at the second molars. And I'm just gonna have you lift your tongue up for me. And Wharton's ducts are also visible beneath the tongue as well. So I'm just going to now have you stick your tongue out for me and say ah.
Ah.
So uvula is midline, and soft palate rises symmetrically, which is great. And your gag reflex is present, and cranial nerves 9 and 10 are present as well. So I'm just gonna have you stick your tongue out for me, and then lift your tongue up, lift your tongue down, and then I'm gonna have you push your tongue against my cheek, against your cheek there, against my hand. Same thing on this side. Great. So cranial nerve 12 is intact as well. Okay, great. So next I'm just gonna assess your jaw. So I'm gonna have you relax your jaw and close your jaw. Relax your jaw, close your jaw. Great. No TMJ is present. I'm gonna have you clench your jaw for me, and then push against my hand here. Great. And then push against my hand here. Great. So cranial nerve 5 is intact as well. And then next, what we're going to do, is I'm gonna have you smile and frown, puff out your cheeks, raise your eyebrows, furrow your brows. Great. So cranial nerve 7 is intact. Next, we're going to move on to your neck. Observing your neck, there's no abnormalities present, there's no discoloration, no scaling, no rashes. Do you mind if I feel your neck? Okay, so trachea is midline. So I'm just going to feel your lymph nodes. So the preauricular nodes, postauricular nodes, occipital, tonsillar nodes, submandibular and submental, antecervical, antecervical, postcervical, and supraclavicular. And was there any tenderness when I was doing that at all?
No.
Okay, great. Do you have water handy somewhere? So I'm just gonna have you take a sip of water. I'm gonna have you hold it in your mouth. Hold this, a bit of water in your mouth. And then when I say so, just swallow the water, okay? So I'm just gonna assess your thyroid here. So thyroid is not visible. It is palpable. Here's the cricothyroid and the thyroid membrane. So what I'm gonna have you do is just swallow now. Great, so thyroid is non-visible, like I said, but palpable, smooth with no nodules. So that's normal finding. Great, so next we're going to move on to your back. So I'm gonna have you just turn for me. We're gonna take a look at your back. So observing your back, there's no open areas. It is symmetrical. There's no rashes or scaling or lesions. Do you mind if I touch your back?
No.
Please tell me if there's any tenderness or pain when I do that.
There isn't.
Great. So next I'm just going to place my fingers under your axilla, and what I'd like you to do is I'd like you to take a big breath in and then out. Okay, great. So thoracic excursion is symmetrical and equal bilaterally. So next what I'm going to do is something called tactile fremitus. So I'm going to place the ulnar aspect of my hand on your back, and I'd like each time I place it for you to say 99.
99. 99. 99. 99.
Great. So tactile fremitus is present and equal bilaterally. Next, what we're going to do is I'm just going to percuss your back. So if this gets to be painful, just let me know. So resonance is heard over the lung fields, which is normal. Okay, great. So next what we'll do, I'm just gonna take a, actually first, before I do that, I would like to first assess for your lung, your diaphragm expansion. So I'm gonna assess via the mid-scapulary line. And what I'd like you to do, Shelby, is I'd like you to take a big breath in and hold it and then release when I say so, okay? So take a big breath in and hold it. And then let go. Okay, great. So that's about 3 centimeters. We're gonna do the same thing on this side. Okay, so what I'd like you to do is the same thing. Take a big breath in and hold it. Okay, and let it out. So again, about 3 centimeters, which is normal. So now I'll be listening to your back. So each time I place my stethoscope, I'd like you to take a breath in and out for me. Lungs are nice and clear. So before I move on and listen to your lungs from the front, I'm just going to do some percussion of your back to assess for any tenderness on your flanks. Any pain or tenderness with that?
No.
Great, so no CVA tenderness is present. So now we're just going to move on to your front. So if you could turn back to where you were initially. So I'm just going to take a listen to your upper lobes and then also your middle lobe there on the right. So you take some breaths in for me now. Excuse my reach. Great. So nice and clear still. So now we're just going to move on to the cardiac portion of our exam. Looking at your chest, chest is symmetrical. There's no deformities or abnormalities. There's no visible pulsations. Do you mind if I touch your chest? Great. Supraclavicular. Just feeling for any heaves or thrills here. Left sternal border. Then we're moving to the fifth intercostal space, midclavicular line. Just feeling for the point of maximal impulse. Great. Now I'm just going to feel for your carotid pulses one at a time. I'm just going to listen for any bruits on those same carotids. What I'd like you to do is each time I place my stethoscope, just hold your breath for me, okay? Try to be quick. So hold your breath. Great. Let it out. Hold your breath. And let it out. Okay, great. And next we're just going to listen using the diaphragm of the stethoscope now. So I'm just going to start back to where I was at that point of maximal impulse, excuse me. The fifth intercostal space, midclavicular line, the mitral area, and then we'll move to the tricuspid area, the fourth intercostal space, left sternobordal, and then we'll move up to the pulmonic region, second intercostal space. And then over to the aortic, also second intercostal space, right? Great. Now we're just going to do the same thing, assessing for any low murmurs using the bell of the stethoscope. And then up to the tricuspid and the pulmonic. And the aortic. Everything sounds good. I'm just going to take a look at my note card here and make sure everything that we did today is what we discussed. The only thing we missed was the hockey and baseball test. Excuse me, I'm gonna have to choose some different words. So we're gonna assess your hearing. So what I'm gonna have you do is I'm gonna have you cover one of your ears and I'm gonna assess if you can hear me. So I'm gonna have you cover your right ear first, and I'm gonna I want you to tell me what you're hearing. Okay?
Okay. Basketball.
Great. And I'd like you to cover the other ear, and we'll do the exact same thing.
Tennis.
Great. So that's awesome. So so your hearing is intact. So that is the end of our exam. Do you have any concerns or questions for me today?
I don't think so.
Okay, great. Thank you.
Thank you.